This week, members of the White House Coronavirus Task Force will testify before Congress as members of the House ask the question on the minds of many Americans stuck at home right now. What's up with the delay in testing, and is there a national strategy to address it?
There is a national strategy. We've been executing on it for months.
Almost 6 months into the pandemic, the administration is under fire about delays in testing. In an op-ed for CNBC, former White House Acting Chief of Staff Mick Mulvaney wrote, "In order to fix the recession, we need to fix the testing problem," calling the delays inexcusable.
I think discussions like everyone who wants can get is not where we are. We're in the middle of a historic pandemic.
Assistant Secretary for Health Admiral Brett Giroir tells Newsy the focus right now is on the very ill and vulnerable.
Number one is making sure that we can diagnose everyone in a hospital setting within 24 hours. And we're really doing that. That's very important because as opposed to March, we now have treatments. We now have remdesivir. We now have steroids.
But that isn't the case for others. On July 11th, feeling ill and having vulnerable members of my family, I decided to go to a drive-through testing site. As of July 28th, no results. Giroir calls my case an outlier and stresses times are improving due to so-called pool testing.
LabCorp has already announced, even yesterday, that they're expected their turnaround times to be 2 to 3 days, so significantly improved.
However, a spokesperson for Quest Diagnostics, one of the largest commercial labs in the country, told Newsy Tuesday that while they've seen an increase in capacity due to pool testing, they haven't seen an increase in turnaround times for molecular tests yet. Results are available about 2 days for priority patients and anywhere from 7 days to 2 weeks for everyone else. They say the delays were partly due to a strain on supplies and demand from the Sunbelt states. But a frustrated Colorado Governor Jared Polis complains that the delays are defeating the purpose of the test. Long waiting times for results make them, in his words, almost useless from an epidemiological or even diagnostic perspective. Amber Strong, Newsy, Northern Virginia.